This video summarizes a modified procedure used to implant a total artificial heart in a patient with a history of congenitally corrected transposition of the great arteries, pulmonary atresia, and ventricular septal defect. In contrast to a normal heart, the anatomy of this patient's heart presented a challenge to TAH implantation, as it is characterized by L-looped ventricles, a morphologic left ventricle on the right side and vice versa, as well as transposed great arteries, with the aorta anterior and leftward to the pulmonary artery. In patients with normally structured hearts, the TAH replaces the ventricles in a crisscrossed arrangement. For the patient with transposed arteries and inverted ventricles, the surgical plan included modification of the TAH such that the right and left pumps were implanted in a parallel orientation. The patient in this case report was able to return home and regain health and strength prior to being successfully bridged to heart transplantation 5 months after receiving the device, demonstrating that with technical modification, TAH is feasible even in patients with structurally abnormal hearts.
The advantage of the total artificial heart is that, in fact, you take the entire heart out and you're placing a total artificial heart, unlike many of the mechanical devices that we have now, which actually help the heart while it's still in situ. Patients have tried to be supported with VADs, or ventricular assist devices, in the past. The problem being is that you have to continue the immune suppression. However, with the total artificial heart, you can take the whole heart out and stop the immune suppression.